Good afternoon, everybody. We're here with Dr. Rachel Herlihy, our state's epidemiologist, to share the latest modeling data of where we are with COVID in Colorado. We're also joined by Department of Corrections Executive Director Dean Williams and Human Services Executive Director Michelle Barnes, who will be available to answer questions about the steps we're taking to protect those in state custody with regards to vaccinating state workforce that come in contact with others in a custodial relationship. We're also joined by Colorado's Lieutenant Governor and the head of the Office of Saving People Money on Healthcare, Dianne Primavera, who's joined us as well. The new positives for the day is 2,023 new cases. Hospitalizations continue to increase. We're at 606 Coloradans currently hospitalized with COVID. That is an increase of 20 from yesterday. So we're continuing to see that level of increase. And we are not yet seeing a downward trend in cases or in hospitalizations. So I encourage Coloradans to be careful. Nearly every case is the Delta variant, essentially every case over 98%. It is more contagious. You know the precautions you need to take around others, indoors, mask wearing. Most importantly, vaccinations. If you haven't been vaccinated yet, please get vaccinated. Those are some of the latest numbers. I really invited Dr. Herlihy here to update the people of Colorado on the trends we're seeing in Colorado, where that tracks with what we're seeing nationally. And with that, I'll turn it over to Dr. Herlihy.
Good afternoon, Governor. Could you please bring up the slides? Thank you. So as the governor mentioned, I wanted to provide a quick update today on the rates, hospitalization rates, and then also death trends that we are seeing here in Colorado compared to the rest of the country. Things are a little bit different here in Colorado than the rest of the country. I want to talk a little bit about what we're seeing and why it is different, how it's different, and then talk a little bit about what some of the reasons behind that might be. But starting here with a map of the U.S. showing color-coded rates across the country, the areas shown with the darkest blue color are going to be the states where we're seeing the highest rates right now. So you can see that overall Colorado is experiencing lower rates of cases. I'm looking at a 7-day case rate here compared to the rest of the country. You can see that the place in the country where we're seeing the highest rates right now is the Southeast. And there really are probably multiple reasons that could help explain why we are seeing variability across the country right now. We do know that vaccination rates can certainly influence what case rates look like from community to community, and so that certainly could be a factor, as well as the pre-existing level of immunity, so what prior infection rates may have existed in one state versus another. We also know that there's elements of seasonality with respiratory viruses like COVID-19, and so that could certainly be another factor that's contributing to differences that we're seeing. It also could be that certain parts of the country where schools have gone back in session, we've seen a more rapid acceleration. That's certainly a trend that we are seeing in some states right now, and certainly why we need to have strategies in place to make sure that our school-age children are protected at this time. Next slide, please. So additional data that shows you the difference between Colorado and the U.S. right now. So this figure is showing overall rates of cases in the U.S. compared to Colorado over time. If you look to the far right of this figure, you'll see our most current rates in Colorado compared to the U.S. And what you'll see here is that Colorado's rates, as I mentioned in the last slide, are certainly lower than what we're experiencing in the rest of the country right now. You'll also see, if you look at the steepness of those lines, you'll see that the steepness of the Colorado line is not quite as steep as the U.S. line, meaning that our cases, while they're increasing here, they're not increasing quite as rapidly as we're seeing the U.S. rates increase right now. But I do want to say that, given the experience that we had last fall, given what we're seeing in other states right now, I don't think that we are immune to seeing a rapid increase in cases here. In fact, today we actually saw our greatest increase in cases that we've seen on a single day since May. So I do think we are at risk of seeing a rapid increase of cases here. Thankfully, we're not seeing that, at least haven't been seeing that the last few weeks here in the state, but that certainly is a possibility, and again, is why we need Coloradans to stay vigilant. Next slide, please. Similarly, again, looking at case rate data, but here we're ranking states from states where we're seeing the highest rates, starting with Florida, then all the way down to Nebraska, Vermont, New Hampshire, and seventh from the bottom, we have Colorado here. You can see the overall difference that we're seeing in rates across the country. So the rates we're seeing here in the state are certainly higher than we would like them to be right now, higher than we hoped they would be during the summer when we expect people to be outdoors, transmission to be less likely to occur between people. But certainly what we're experiencing here in Colorado is not the same as what's being experienced in the southeastern part of the country. Next slide, please. All right, moving on to hospitalization data. So this figure is showing you the difference between hospitalization rates in the US compared to Colorado. Looks very similar to the case rate figure that I showed you, where overall you can see that the rates are much higher in the US compared to Colorado, and also the steepness of that line for the US is steeper than the Colorado line overall. Next slide, please. A very similar figure that shows you where Colorado stands as far as our hospitalization rate compared to other states across the country. Again, we're towards the bottom of this scale here, so you can see the highest rates of hospitalization are occurring in those same states where we're seeing the highest rates right now, primarily states that are in the southeast part of the country. Next slide, please. And then finally, this is a map that is showing you overall rates of deaths that are occurring from state to state across the country. And this, I think it's important to note that the scale here is compressed a little bit, so you are going to see some differences in the overall number and compression of some of the states that are in these smaller ranges of death rates. So keep that in mind when interpreting this figure. But in general, you can see that Colorado, again, similar to the case and hospitalization rate data, does tend to have lower death rates than most of the country right now. Next slide, please. And then finally, this figure shows you, similar to the hospitalization curves and case rate curves that I showed you, overall trends in deaths in Colorado compared to the US right now. One thing that you'll notice is that the increase that you see in deaths right now is not nearly as great as the increase that you might see with hospitalizations and cases. I think there's really two reasons for that. One is that the death data lags quite a bit behind hospitalization data and case data. That's because it can sometimes take days, weeks, even months for individuals who have a severe infection to die. And so that data is going to be lagged. But it also takes time for that death certificate data to be coded and reported to public health. And so you see that play out in some of the delays that we see in reporting of death data. But overall, the same trend holds true here, where you see that the mortality rate in the US is certainly greater than the mortality rate that we're seeing here in Colorado right now due to COVID-19. Thank you very much.
Thank you, Dr. Herlihy. So in short, again, it's just a time for being cautious, being vigilant, not a time for panic. You know how to reduce your likelihood of contracting it. Get vaccinated, of course. Wear a mask around others. Avoid crowded indoor spaces. There is widespread community transmission. The vaccines offer a high level of protection, but no level of protection is perfect. So we're doing better than most states, but there is widespread community transmission, and Coloradans should remain vigilant. We are currently at 72.5% of adults in our state have gotten at least one dose of the vaccine. 66% of people 12 and up have gotten at least one dose. It's good numbers, and for those who are protected, that's of great consolation to them. But it's not good enough to stop the variant. It's not good enough to stop COVID. That's why we've begun implementing new policies, working to get even more folks vaccinated. Most recently, and the state, by the nature of the work we do, there's folks who are in contact with our state workers and have no choice but to be in contact with them. And that might mean they're residents in our state's own long-term care facilities, in the facilities that we operate around youth services and prisons. And, those who we serve, we have a special responsibility to not endanger the lives of. And that's a responsibility that's on us. That's why we recently announced that the subset of state employees, mostly Department of Public Health, the Department of Corrections, and Department of Human Services, those agencies, we have the two directors here from the main agencies impacted, not all their employees, but their employees that are in contact with people who we have a custodial relationship with, who have no choice but to be in contact with them. We owe the people of Colorado the assurance that those workers are vaccinated and have a significantly reduced likelihood of transmission to those that we are in contact with, that we are in custody of. Congregate living settings, our Fitzsimmons Veterans Home. And I've been there a couple times. It was really one of the most joyous days of my governorship when we gave the first doses of the vaccine to Korean War and Vietnam War veterans at Fitzsimmons to offer them protection. And the vast majority of people who go to work with our veterans every day at Fitzsimmons are already vaccinated, but some are not. And because the vaccines are not 100% effective and our older and vulnerable populations remain vulnerable, we want to make sure that we are offering our veterans, those we serve, the very highest level of protection. So by September 30th, everyone in this category of state employees will have their first dose, fully vaccinated by the end of October. And of course, across the rest of the state employees, we encourage vaccinations, and if you're not vaccinated, then you can be tested, and we are developing the protocols for that as well. But we just have that special responsibility to those in our custody, and it's very clear that this is the right decision to make. These kinds of requirements are certainly not something I take lightly as an employer, but the data is clear in showing the vaccine is the best line of defense against the virus, better than masks, better than other methods. The more you do to protect yourself, the better. But the vaccine is the most effective. And we're staring down the barrel of the Delta variant, and that's why we need to protect those who are in our custody. It's our responsibility as a state to do so. And by taking action with our own workforce, we're hopefully inspiring other employers, long-term care facilities to do the same thing. In that same vein, I sent a letter to the State Board of Health asking that across other health facilities, that people that are working with Colorado's most vulnerable are vaccinated. And I applaud the medical care providers. Many of them have already taken similar steps: UC Health, Banner Health, Denver Health, Children's, SEL Health, Rocky Mountain Regional VA Medical Center, National Jewish, Boulder Community Hospital, Kaiser. There's senior living facilities like Genesis and Vivage that have done that. But we know that we can do better. And we know that we have a special responsibility for those who work around our most vulnerable to be protected through vaccination. Coloradans shouldn't have to worry about whether you're exposed to the virus from the very person who is supplying you the health care that you need to live. The AARP, health leaders across the state are joining us in calling on the State Board of Health to take this action. The fact of the matter is that increasing vaccinations is how we're going to beat the Delta variant, maintain the level of normalcy that our vaccinated population has received and achieved and lives in. And we need to make sure that we no longer provide the virus the environment that it needs to linger and mutate, needlessly endangering lives. The FDA also recently approved third doses of the vaccine for immunocompromised individuals. Of course, 2 doses are effective, but for those who have moderate to severe immune deficiency, it is less effective. The vaccine is 90% effective in preventing COVID-related hospitalizations in healthy Americans, but for those with immunocompromised conditions, it's only 63% effective. That's why we are working to get third doses into the arms of those who have moderate or severe immunocompromised conditions as we speak, as quickly as possible. Earlier today, Colorado Department of Public Health sent a letter to providers offering guidance on how to provide that third dose. And just as we've done with when we had the age requirements, just as we haven't required paperwork or proof of insurance, I want to make sure immunocompromised individuals in our state know that they can simply self-attest to their condition without having to provide additional proof or paperwork. We trust you just as we did about age, just as we did about pre-existing conditions. Vulnerable Coloradans shouldn't have to jump through hoops to get full protection from this virus. And that is the instructions we're sending our providers. Keep in mind that many of them have different policies. If we hear complaints that they are requiring additional hurdles, we will have a discussion with them. But in general, if you are immunocompromised, have a weakened immune system for whatever reason, you should be able to simply attest to that and get the third dose, which is an added level of protection for you from this deadly virus. Immunocompromised individuals can visit any provider in the state and get that third dose. Just like the first and second dose, they're free, they're quick, they're easy to get. To find out where to get your third dose, covid19.colorado.gov/vaccines. I expect some growing pains here, just like we had when we instituted age limits and a few folks incorrectly wanted age verification or citizenship verification or insurance verification, we respond seriously to those. Let us know. We'll talk to the provider. But we expect this to set in the next few days. And if you have trouble getting at one provider, by all means, try another provider for the third dose. To be clear, the third dose is for people who had 2 doses of Pfizer. This is your third dose. 2 doses of Moderna. This is your third dose. We are still awaiting instructions and guidance from the FDA on people who receive the Janssen vaccine. We do not yet have the go-ahead with regard to second or third doses for those who receive Janssen. In addition to the more than 1,500 providers across the state who are administering the vaccine, we're also working directly with our long-term care facilities to identify Coloradans who have moderate to severe immunosuppression, and where we will be setting up vaccination clinics to help protect residents for long-term care facilities. The announcement was also made that we're expecting full approval for the third booster shot September 20th, and we will be working on setting up an implementation model to, on a larger scale, protect the most vulnerable with that additional vaccine. And I was really thrilled to hear that news, that Coloradans can get a booster shot 8 months after their second dose. That means that healthcare workers and older Coloradans will be the very first eligible and the very first that we will be prepared to administer that to September 20th. We'll provide more information in the coming weeks as we get closer to that rollout. We also need to continue to take precautions indoors around others, like mask wearing. We're seeing many schools and county health departments look at the best way to protect their schools. Yesterday, Jill Ryan, the CDPHE director, and I sent a letter to school superintendents encouraging them to really take the CDC and state guidance very seriously in implementing safe schools. We also know that for schools that haven't signed up yet, we have the free testing services at covid19.colorado.gov/free-testing-schools. They can also sign up for free medical grade mask delivery that we supply to the schools through CDE. We want to make sure that schools are in person for the semester, whatever it takes. I also want to indicate that I have been following the discussions in many districts and county health departments around mask wearing requirements for schools, and that's a very important discussion to have. And there are inevitably in all districts in our state parents that are thrilled with their local policies and parents that are disappointed. There are parents in districts that require mask wearing, where the parents are very upset and don't want their kids to have to wear a mask. There are parents in districts that don't require mask wearing that are worried that the lack of that kind of requirement is putting their kid at risk. What I want to make sure that we send as a message to folks is, even if you're disappointed with your own district's or county's department on exactly when or if masks should be worn, there's actually something more important than what a district's mask wearing policy is, and that's civility and respect. And if we differ with our leaders in different areas, that's okay, and we have a voice to do that. But what's not okay is threats or violence or getting in the way of education. And I call upon Coloradans of all persuasions to express their opinions civilly and thoughtfully with regard to all matters, but particularly with regard to mask wearing requirements in schools. Our school districts, our county health departments are doing the very best job they can to balance the equities, to balance the perspectives, to meet the needs of the local communities in ways that has the support and buy-in of parents. And that's not an easy job. And as I said, I think in every district, regardless of their policies, there will be some disappointed parents. It's okay to be disappointed. It's okay to voice your viewpoint, but it's also critical that we maintain civility and respect for those whom we disagree with, regardless of your opinions and regardless of the decision of your district. In districts that are not requiring mask wearing, we should not cast aspersions and somehow say that those school board members or county health officials want to kill kids by not requiring masks. In districts that are requiring mask wearing, there is no one on those boards that is trying to unnecessarily restrict freedoms or wants mask wearing for the sake of mask wearing. I think every district that's implemented mask wearing requirements can't wait until that requirement is no longer needed. And it's just for a matter of months that will likely remain in place. And that will be an ongoing discussion especially until the vaccine is available for 5 to 11-year-olds. It's already available for 12 and up, and that's why some districts have decided that if you're old enough, if the kids are old enough to get the vaccine, then there's no longer a mask wearing requirement for that age. So it's a very important discussion to have. But what's more important for the people of Colorado and for public education than the particular outcome of that discussion in every area is that we have that discussion with civility and respect. We're all in this together. We're going to get through this together. The more people get vaccinated, the sooner we can defeat the virus, return to full normality. Friends and family are many trusted messengers. In this case, the impact of discussions you have with your family, with your community, can be very important just by having a conversation. And yes, it can be a difficult conversation with someone you love. But, approaching them, the worst that can happen is they don't change their opinion and continue not to be vaccinated. So there's upside, but very little downside, as long as you maintain civility and respect of people's individual choices with regard to vaccination. Thank you, and I'm happy to take some questions.
So this is Meg Wingeter from the Denver Post. Dr. Herlihy had said about returning to school may be a factor in the surges that we're seeing in the South. So how do you said about the real goal is to keep schools in person for hopefully the full year. How do those things square with then leaving it up to each district of deciding whether they're going to require any precaution?
It will be harder for districts that are not implementing COVID mitigation measures to be able to assure parents that they will remain in session throughout the year. And that's a difficult balance to reach. I would add, though, that there is going to be a correlation between communities that don't require mask wearing, that are generally communities that, as a value, have a higher risk threshold with regard to COVID in their communities and the administration of schools. Remember, many schools were back all last year, and that was in part because they have a different cost-benefit analysis of the very small risk to children of getting the virus versus the risk of public health and spread in the community. The best way to defeat this virus, vaccinations. In the meantime, even parents that live in districts that don't require mask wearing can absolutely make sure that their kid wears a mask, and we value the rights of parents to be able to choose that regardless of where they live. Our threshold as a state is, of course, our hospital capacity, as it is for adults, as it is for kids. And we also want to make sure that we have as much uninterrupted in-person education as possible. Doesn't mean there won't be short periods of quarantine where necessary, but if there are so many quarantine issues that it affects the ability to successfully remain in person, then we'll look at additional state actions.
Thank you.
Are you worried at all about the push to get immunocompromised people their third doses and also the booster doses that are coming out in September affecting the ability for the state to get people their first and second doses? Does the state have the capacity to do both, and how do you manage that?
Yes, we have far more capacity to administer doses than we have demand. And that's why we have been going out and aggressively seeking demand for people to get their first and second doses. And by the way, their first and second doses remain even more important than a third dose from a public health perspective, a societal perspective. Those two doses and people who've had 0 doses, that remains the imperative. But we can walk and chew gum at the same time. We have plenty of Pfizer and Moderna doses in state and plenty of capability to begin the third doses for those who are immunosuppressed without in any way slowing down with regard to first and second doses. Hello?
Governor John Frank here. A question for you about these booster shots for the immunocompromised and the ones to come. Do you think it's appropriate to be offering booster shots when people in other countries, can't even get their first shot?
Well, Colorado would love the ability to export any excess vaccine we have, but we don't have that legal ability. I hope, and we've called upon our federal government to continue to donate doses overseas. But our goal here will certainly be to use every dose that we receive. And we want to use them for first and second doses, as well as for third doses for those who are immunosuppressed. And then beginning September 20th, third doses more widely available. There is plenty of dosage that our federal government has, and I know they've begun donations to other countries, and we hope that they can increase the numbers that are available to those in other countries. I would just add, from a global health perspective, the more vaccinated people of the world are, there's a greater health benefit to the people of our country as well, because it reduces the likelihood for mutations. Every person who contracts the virus has a chance of spontaneously creating and spreading new mutations. Many are created, many die out because they're less adaptive. But as we saw with the Delta variant, it started somewhere with someone. And if the infection rate globally were lower, it will be less likely that additional variants that are potentially worse will arise.
Thank you.
Mm-hmm.
What we're seeing across the rest of the state. There were incentives that were already offered. Is there any confidence that this stick approach will work? And are you worried at all about losing employees who refuse to get vaccinated by that deadline?
Sure. Let me bring Dean and Michelle might want to comment on this.
No, thank you for the question. Dean Williams, Executive Director for Department of Corrections. Our entire department toiled over this decision over the last few months. We certainly don't want to lose staff as a result of this mandate. We did provide incentives. We got another 5% or 10% of the employees to take the vaccination. But what's really changed over the last few months and really moved us is really the risk around the Delta variant and how this has been a moving target. So in our department, we believe that, and I'll let Michelle speak for herself, that we really have a duty to protect each other and the duty to protect people in our custody. And that presents unique responsibility, as the governor mentioned, and our unique duty in our department. And so I want to retain every staff member who works for me right now today, but that doesn't alleviate this special sense of responsibility and duty that we have to each other as a department, and especially to those people in our custody. So we didn't arrive at this decision lightly. We've looked at the special moving circumstances around the variant, and that's why we've landed there, because we really know it's the best and safest way to approach the fall and the winter.
Michelle Barnes from Colorado Department of Human Services, and let me add to that. Dean and I have spoken many times about this situation and have debated and thought and conversed with experts in trying to determine if we would have vaccines be part of an employment situation with our employees. And for the reasons Dean said, we came because of the Delta variant. We decided the time is now and we have to do it. At CDHS, we have over 77% of our frontline staff have gotten the vaccine, and we're so proud of them. And the incentives helped, and their service above themselves to make sure the people in our care are getting what they need and it's safe. But we're still having outbreaks, and a lot of the people in our care, I'll use one of the state mental hospitals for an example, they're not there because they chose to be there. They're there because they were assigned perhaps by a judge to be there. And so we have an obligation to them to make sure that their home is safe and that they're safe from the COVID virus. So for that reason, we've decided to do it. I honestly hope not a single employee leaves over this. We've had town halls, both Dean and I, over the last 24 hours to send that message to employees. We want you here. But we also think it sends a message to the employees that have got vaccinated that we also want to provide a safe workplace for you, so you don't have to worry about contracting the COVID vaccine or COVID variant while you're at your office. So thank you.
I do have one follow-up. The Biden administration, within the next hour, is expected to announce that it's going to require nursing home staff to have their staffers vaccinated or face losing Medicaid, Medicare. Obviously, still waiting for the details to come out, but any worry that that's going to hurt the very residents who are most vulnerable?
I haven't seen that yet, so I it must have did that just come through this morning? So let us look at that and we'll get back to you, but I have not seen that yet.
Hi, thank you, Governor. This is Erica Meltzer from Chalkbeat. And I will have a follow-up question, so I hope I can squeeze two in.
You can. Go ahead.
First of all, on schools, in the letter that you sent yesterday, you seem to be strongly encouraging masks to schools to require masks at least for unvaccinated people. And then today, I am again hearing this respect for sort of local control and different risk tolerances. And so my first question is, if there really is one right answer here, that we need masks in schools, why are we waiting to do a state mandate? Or if this really is a matter of local risk tolerance, why did you send the letter?
So I've said, as a parent of a 9-year-old and a 7-year-old who are too young to be vaccinated, that my kids are going to wear masks to school. Now, we live in an area where it's required, and I've said if we lived in an area where it wasn't required, I would still want my own kids to wear a mask as my parental choice. Why? Because I've looked at the data, and I know that masks absolutely have a positive impact on reducing the spread of the virus. I think what many parents and educators also argue is that masks are relatively low cost with regard to education, but they are not zero cost. There is something lost on the social emotional side, and there is something lost on the pedagogical side, however minor, when the face is obscured by a mask. And so that is a discussion that's being had at school boards and county health departments across the country, and it's an important one to have. The point I made today is I think the most important aspect is civility and respect, because everybody doesn't agree, and that's okay. It's okay that people don't agree, but we have civil and respectful ways that we express that. We also have a system in our state in place where, at least in many areas of our state, the opinions of many parents in that area, the majority of parents through our democratic institutions of school boards, are generally reflected in the safety protocols that are taken in the school. And it's also okay that different communities and different families in different areas have different risk thresholds in our state. There's no right or wrong with regard to risk thresholds. I mean, there's parents that don't let their 16-year-old drive because they're worried about the safety of 16-year-old drivers. There's others that do. And, you know, there's parents that want to send their kids to school with a mask, as I would, to protect my kids. And there's parents that believe that, however slight, the learning loss and the loss of being able to view people's faces is not worth the increased safety of wearing a mask, even for a period of months. My role is to look at statewide hospital capacity to make sure we never encounter a situation where our ability to serve people is overwhelmed by the level of COVID hospitalizations in our state. And secondly, we of course want to maintain in-person education. And we will continue to give the very best advice we can to school districts, just as the letter with Jill Ryan was yesterday, that we believe, based on the data, that the best way to ensure in-person education is to take the CDC and state health protocols seriously and implement strong COVID mitigation techniques in schools across the state. Go ahead and ask a follow-up.
Yeah, we've had, you referred to wanting to maintain in-person learning, and we've had school districts in a number of communities say that they're not going to be enforcing any quarantines, that they won't report any COVID cases to the local public health department. And so if that's the case, it seems on the one hand, we will maintain in-person learning sort of regardless of what happens with COVID. And I'm curious what your reaction is to that, and if that makes sort of how that relates to your role as the state in ensuring the schools are safe.
Those are two different things. I believe COVID has to be reported, yeah. So those are two different things. Quarantine protocols, we give the best guidance to the districts, and it is up to them to implement. We do require reporting of COVID. That is not an ambiguous area. So those are just two different things. Did you have a follow-up on that? Or, I mean, I'm not, did I address that? So yes, quarantine protocols are up to districts.
So we have had school districts that said they weren't going to report COVID cases to the health department, that they don't consider that anyone's business but the family. That's District 49.
We have not heard that. Please pass those along to
Gazette.
us. What's that?
It was in the and it was in the Gazette and discussed at a recent school board meeting.
Yeah, COVID cases they are reported as a function of public health, just as a number of other diseases are reported which is very important. The quarantine protocols, we have the guidance, and it is up to school districts how to implement that. We believe that when you implement mask wearing, that also lessens the severity of the quarantine protocols that we recommend are implemented, because if people are masked, they are not considered direct contacts if both parties are masked. So we think that masking provides greater flexibility around quarantine protocols, but the guidance is to be implemented by school districts. Of course, cases are reported to county health, need to be reported to county health. That is the law, and that is unambiguous.
Hi, it's Marshall at 9 News. Can you hear me okay?
I sure can, Marshall.
Sorry, I had to switch mics. This one's for DOC Director Dean Williams. Director Williams, this is not a hypothetical. What happens when corrections officers quit instead of getting vaccinated, or you're forced to fire them because of not getting vaccinated? How do you manage the prison population with shrinking staff? And where's your staffing level right now?
Well, we didn't make this decision with hypotheticals in mind. We knew that was a possibility. I'll mention this, Marshall. During the height of the pandemic, we had about 500 staff at one particular time that were actually out as a result of having COVID or being exposed to COVID. And so this department will do what it needs to do with however many staff we have. And we've been looking at contingencies on that. We have contingencies on that. We had contingencies on that during the height of the pandemic because we were in thin spot. So we are hoping for the best, but you prepare for the worst. And that's the way correction systems across the country run. That's the way I'm running our system. And so we know that risk exists. Here's the deal for our department. The risk of not taking this step potentially exposes us to another onslaught of the variant in the fall and the winter. So this really is a case, as my dad used to say, kind of a damned if you do and damned if you don't. But this is the right thing to do, knowing that even those risks of staff not showing up or who may just decide this is not the department to work for. I hope that's not the case. We're preparing for that, but I've asked my staff today in the town hall meetings to sit with that a bit, talk to their medical providers, get counsel, get good advice from the right people around what to do about it. But I'd rather deal with this now than wait 3 months from now when we're even in worse shape and don't have this space to make this kind of decision. So, as I mentioned earlier, we've looked at this and we've toiled over this. We're not the first state correction system to do this in the country. Washington just announced this not long ago. And so we're looking at what is happening in those other states as well. But we've been planning for this for a while. And I have my leadership team out engaging with prisons right now as we speak. And granted, I'm asking my staff to struggle with this a bit and to know that our sense of duty and responsibility is unique compared to other locations. And I'm sure Michelle feels the same way. But that's the approach we've taken, and I think we're prepared for eventualities. That's in fact what our department's about, Marshall.
My follow-up would be, how do you plan and prepare for this? Restaurants are struggling to get staff back. How do you prepare for prisons to possibly have less staff?
Well, I mean, if you ask my staff right now, they know that they have had to be required, especially during the height of the pandemic, to work overtime. We've also put out for temporary staff. We've asked for retired staff to come back. We've gotten some results out of that. Quite frankly, I'd like more. But the issue of staffing in the correctional system is an ongoing issue with every other one of my colleagues around the country about having enough staff to work in this department. And so this is not a new challenge for us, a new battle for us. There's a side of me that would rather not face this, right? But that's not the wise thing to do. Wisdom on this is to say, look, this is the position we need to take now while we have a little space to really struggle with it. And we have until the end of September when the first dose has to be administered to staff. So it gives us time to sort of work with staff and talk about it. Part of this is the unknown. And I'd be lying if I say there wasn't a little bit of trepidation around the unknown. But the reality is it doesn't change the equation. And so we've dealt with low staff before. We'll deal with it if it comes up again. But I've asked my staff to toil and struggle with me over this decision, and hopefully they will and come to the right conclusion and stay with the department because we appreciate them and we need them.
Hello? Any additional questions from the room or follow-ups? Okay. Thank you all for joining us. Stay vigilant and let's be careful. And if you haven't been vaccinated, get it done. The anxiety around not getting it is much worse than the actual vaccine itself. Good luck.